Okay, so one thing that I've actually found recently with a few people I've been working with is they're having some pain or some stiffness, some tightness, generally in the low back, upper glute area, one side or the other. That tends to generally be right around that glute medius area. And a lot of times squatting and any type of pulling or deadlifting from the floor causes pain or discomfort. And what I've found personally with a lot of the people that I've dealt with this with, generally it comes from a couple different things. One, if you look at our lifestyle in this country as a whole, we spend so much time sitting. When we sit, the anterior side or front side of the tissues in the body, because everything's shortened, ends up shortening up and tightening everything up on that front side. So what happens is everything gets kind of overstretched on that back side, the pelvis gets rotated, and so you feel some pain and some tension on that back side of the body because it's constantly in an elongated or a stretched state. And so if we can open up some of that tissue that's going to help this relax and let that pelvis sit in a more neutral position, help bring the posture up a little bit so you're not so pulled in, that tends to help with a lot of those issues or a lot of that pain you're feeling on the back side of the hip. Couple things that I found that really help. Number one, taking a lacrosse ball, a baseball, or some kind of firm ball and actually trying to roll out right above the top of your femur, your thigh bone here. There's a small space between the thigh and the hip, or the thigh bone and the hip. Rolling in that right in there, or sitting on it on a ball right in there, and going a couple inches each direction laterally. And so when you do that, there's a lot of small muscles, a lot of small tissue that come into this part of the hip. And so relieving a lot of that tension, a lot of that stress will tend to allow that to open up, help some of that relax a little bit. Then I'm going to go over some stretches that will help relieve some of that from potentially coming back or hopefully coming back. So first off, take a lacrosse ball, a baseball, softball, something of that nature, something that's hard. I also recommend, if you can tolerate it, doing it on a hard surface. You see I'm doing it on a hardwood floor here. Carpet or turf are fine, but when you have something that's cushioned or even a tennis ball, it's just not going to push in and dig into that tissue quite as well. So again, if it's so painful you can't sit on it, then you've got to find ways to counteract that, if that means doing it on carpet or using a tennis ball instead. And you can feel it digging into that tissue. You can feel the tissue getting relaxed. You sit in there, then that's going to provide adequate tension. For a lot of people, especially someone like myself who squats often, pulls often, the tissue gets really tight in there, so a hard surface and a hard ball tend to work better for me. So first off, just setting the ball on the ground. Okay, I will actually put it right on that side of the hip, and then see my pain face. Just relax into the ball. Try to take big, deep breaths. I recommend a lot of nose breathing. You want to really try and breathe through more of your diaphragm. And you can kind of lay on any direction. You can lay flat on the ground. You can hold yourself up. Just wherever you can let your hip and your body relax into that tissue. Okay. You can roll around a little bit, but I recommend just finding a spot with the ball and just letting that ball sink in there for 2 minutes. 2 to 3 minutes. Spend anywhere from 3 to 5 minutes on the whole hip area. Pick 2 or 3 spots. Let that ball sink in there for about 2 minutes per spot, and then move to the other side. If you're having issues on one side, do work on both sides. You don't want to create an imbalance or difference there. So once you've done that, there's a couple different stretches I recommend that I found work well for me and with the people that I work with. One is just doing your basic pigeon stretch. So you will put one elbow, get in a big lunge position, take one foot to the ground, okay, and then try and lay your shin flat on the ground. With that, you can do this, and you can go in a couple different directions with this. You can lean straight forward, you can lean out over your knee, you can come more towards the foot, okay? Generally, I found the more towards the foot you are, the more you get up in that hamstring glute area, the more towards the knee you are, you feel that more on that lateral side of the hip, the lateral side of the glute area. So I like to get kind of in the middle, and I'll actually go around in all 3 places, or just kind of rotate through. But again, you want to try to relax into that position. Spending 2 minutes each side there. Another good one that I like to do, that's going to help with external rotation of the hip. Another one I like to do, I stole this from John Davidson. He's the one that initially showed me this, but I've seen a few other professionals, such as Quinn Henoch and a couple other people use it too. Starting off where you're in an internally rotated position and you're trying to basically come into a butterfly, rotate into the other, hold each one for a few seconds, okay, and spend 2 to 3 minutes at a time doing this, okay. And there's a couple different variations you can do with this, but this is kind of the basis just a general one that I use a lot. So another one that I like a lot, and generally if you have a pillow, this will help if you are on a hard surface, is a kneeling hip flexor. Again, I find with how often we spend sitting, if you can open up a lot of the tissues on the anterior side of the hip, that helps that pelvis sit in a more neutral position. It helps alleviate a lot of back pain and a lot of back pressure. And especially because oftentimes we don't train getting into full hip extension very often unless you're doing things like hip thrusters or lunges, where when you go down, that hip is getting into extension. If you skip out on a lot of unilateral work like that or any extension work, you're never going to really help set those tissues in the proper place. So, in a lunge stretch, the focus is going to be on the back leg. Like I said, the anterior side of the hip, the front side of the hip. You want to try to keep your torso and your shoulders tall. Spine should be aligned and stacked. But you want to try to keep your torso over your hips the whole time. So if I stretch out really big and I lean forward, okay, I'm going to feel a little bit here. I'm going to feel a lot more of that in the front leg. And it's not really doing a whole lot because I'm broken at the spine, I'm broken at the rib cage, and it's not allowing the tissue to really set in the place it needs to be. So what I want to do is keep the ribs engaged. If you get a big step out and push your hips forward, you still want to keep your torso stacked over the hips, okay? Some people can feel it right here. Some people may need to go out a little bit, okay? You can kind of go back and forth with what's comfortable to you. Another addition to this stretch, when you're in here and you feel that tissue starting to relax, you feel that hip starting to open up, think about actively contracting your glute muscles, and that will help force you into even more extension. Again, keeping the ribs pulled down with the abdominals, the obliques, keeping everything nice and stacked in the torso, and then just leaning forward. Okay. And again, spend 2 to 3 minutes each side. Those are 3 very basic stretches that I'll use to really help with all around hip mobility. What I found the first time that this actually occurred to me, battled it for about 6 to 7 weeks, finding minimal relief. And what really helped it a lot was when I spent some time opening up the tissue, but then I just worked on all around hip mobility. I wasn't focusing on just external rotation, just internal rotation, just on the anterior side of my hip. The more active range of motion you can create in the hip in all directions, the better you move, the less pain you'll find you'll be in. Because what happens, especially when you're talking a lot of low back pain, is your hips and your low back connect. We use our hips for everything. When you sit down, you stand up, you pick something up, the glutes help stabilize the bottom portion of the spine. And so those tissues just get really, really stiff and really tight when we're not opening them up from all the activity they're used from. And so when they start to get tight, they pull on the spine from the bottom side. And so if you can alleviate a lot of that tension in the hips, more often than not always, but more often than not, and from my experience and what I've seen in clients and athletes I've worked with, unless you have a serious condition or pre-existing condition, this seems to alleviate a lot of those factors. So spend a couple minutes rolling out the tissue with a lacrosse ball, a baseball, something firm, something hard. Get those tissues to relax and open up. Do this 2, 3, 4 times a day. And the more often you do it, the less you'll find you really need to do it as you get going and you fix the issues. So hope this helps. Let me know what you think.